Hi, folks. Greg Silverman, CEO of the West Side Campaign Against Hunger, and welcome to our town hall. Uh, and speaking about the turning point, how WSCAH and others in the emergency feeding sector are responding to the changes and challenges in SNAP. So I'm going to start off. Obviously, you can put questions, as Kira, my colleague, has said, in the chat, and we'll respond to things later. After we go through our presentation, but I just want to first give a chance for my colleagues, Allison and Delilah, to introduce themselves, and then I'll kick things off. So, Allison.
Hi, everyone. Thank you so much for joining today. I'm Allison Rosenthal, the Chief Program Officer at the Westside Campaign Against Hunger. I've been working at the organization for over 8 years and excited to share more about the focus of our work today.
Hi, everyone. Also, thank you all for joining. My name is Delilah Guzman. I've been with the West Side Campaign Against Hunger for 15 years now. I'm currently the Senior Benefits Access Specialist here and work on our benefits team, helping people enroll in SNAP and other benefits as well.
Thank you, Allison and Delilah, for joining today. I think, as you're going to hear, folks, we are in busy times for, of course, all the wrong reasons. And luckily, we have a great team at WSCAH fighting the good fight for our community that we support in so many ways. But today we're gonna try to zero in. We're gonna talking about the changes in SNAP, starting with HR1, the big bill that came about in July, which slashed $186 billion from SNAP, the Supplemental Nutrition Assistance Program, over the next 10 years, enforces work requirements on SNAP recipients. And the work requirements are going to affect on March 1st, this weekend. And we're also, these SNAP cuts continuing through what we all remember in November, the SNAP crisis that, really was a tragic month for so many people, and really alerted a lot of people on the front lines of hunger of what's to come. And so, all these cuts, what it really means is more families turning to the emergency feeding sector, food pantries and soup kitchens on the front lines to put food on their home tables. WSCAH is supporting our customers in meeting these SNAP requirements. We're advocating for more city and state funds for the front lines, for food pantries and soup kitchens and emergency food providers. And we're bringing more food to more people so we can better meet this growing demand. Right, as we said, HR1 takes almost 200 billion over the next 10 years. And that's also this HR1 is adding billions, that's billions with a B, to each state's budget, especially New York State, because of the size of the number of SNAP customers, to pay for SNAP, which is really going to be a trickle-down effect of cities like New York are going to have to spend a lot more money to cover the cost of the state that got shifted from the federal government. It's also, as we said, adding in these workforce requirements. A key term you might hear today and in the coming weeks and months is ABODs, able-bodied adult without dependents. So folks who are that traditionally was between 18 and 50, now even above that age, and what they're going to have to deal with, the hoops they will have to deal with in order to claim their benefits that they deserve. So, but first, let's talk about, and we'll start with Allison. Let's talk about what we're seeing and how we at WSCAH are preparing for these changes.
Yeah, thanks, Greg. First, I'd like to dive a little bit deeper into what exactly the changes are within HR1, but just to give you a little sense of the impact in New York, with the passage of HR1, there will be upwards of 300,000 New Yorkers across the state that are going to be in jeopardy of losing their SNAP benefits. And as you mentioned, some of the other components of HR1, the structural changes, are going to cripple the state's budget. And so just to give you like some background to understand what this looks like, beginning in this upcoming fiscal year, FY27, the federal share of SNAP administrative costs is going to drop from what was 50% to 25%. So now states are going to have to cover 75% of all the administrative expenses that go into SNAP. And this is going to put, like you said, significant strains on the budget. It's going to reduce program capacity, and it's likely going to cause a lot of service delays. And these delays are what we had already been experiencing even prior to these cuts. Also, for the first time in FY28, states are going to be required to contribute to SNAP benefits. So for the first time ever, the federal government is not footing the full bill for the benefits themselves, and states are going to have to begin contributing. Also, as you made mention, there's now expanded work requirements. And so adults up to the age of 64, previously it was 54, and it's been increased to 64, including veterans, including experiencing people experiencing homelessness, including former foster youth. Those used to be exemptions, but now everyone is going to be subject to a 3-month time limit unless they meet these strict work requirements. This also impacts parents and grandparents and caregivers of children. Caregivers of children ages 14 or older, they will also be required to meet those strict work requirements in order to have more than 3 months worth of benefits. Again, previously it was 18 years of age. Now it's lower to 14. The new law also sharply restricts SNAP eligibility for immigrants. So refugees, asylees, trafficking survivors, and other humanitarian groups, they were once considered qualified immigrants, and now they're being excluded. So these changes eliminate SNAP access for documented immigrants that used to be protected under federal law. And it's only going to cause that group to experience higher rates of food insecurity. The last item that I will address is that the new law also limits USDA's ability to adjust the benefit levels to keep pace with food price inflation. So as we all know, grocery prices have been increasing significantly. So if prices were to increase further, there would be no ability to adjust the benefits to keep pace with the food pricing. So this will effectively erode the purchasing power and increase food security for millions of households. And so, as Greg mentioned before, the results of all of these policy changes are going to result in, more New Yorkers losing their benefits. And when the public safety net fails, that's when emergency feeding organizations like WSCAH, we step in and step up. So we're anticipating significant increases in the number of households coming to us, not only to access food, but also to help them with all the administrative burdens of the new work requirements. We have a team of benefits access specialists that are quickly getting up to speed to try and understand how we can support our customers. But overall, it's just going to put a significant strain on frontline providers that have already been under significant strain ever since the COVID pandemic. Uh,
Not that I was muted. Sorry, all these years not knowing how to use my Zoom. Yeah, not exactly a rosy picture. And when you dive a bit deeper, and I want Delilah, give us a bird's eye view into the sort of this work requirements. And, as someone who's dealing with individuals on a daily basis, and you've been dealing with this through different administrations, right, over the last 15 years. This is probably the worst version of it, but yeah, give us a bit more of a perspective on on what you're having to deal with and how you're trying to mitigate all this.
Yeah, I think that a really important point to make about these new re work requirements is, like Greg just mentioned, we're trying to, myself and my fellow benefits access specialists have been, and Allison also have been in webinars this week trying to learn about all these changes, how that's going to affect the work that we do on the front lines individually with customers. How are we going to support them with all of this? And it's really confusing. There's a lot of information that's being given to us, and all these things go into effect next week. And if it's confusing to us and we're kind of amongst ourselves having conversations of like, wait, but this person in this webinar said this, but no, we thought it was this, or like we're trying to understand and navigate all these policies ourselves. Imagine our customers. Imagine people who English is not their first language. They're of an older age and maybe they're not as tech savvy to really understand or go online or read these policies. And our work was already hard enough. There were already so many barriers in place for customers, just in general, without these work requirements, with navigating just the application and doing a phone interview and submitting all the requirements. This is just adding layer upon layer of more challenges for customers to get benefits. I believe that it's purposely done that way so that people will just give up and just say, this is too much. It's not worth it. Forget it. I don't want to do this anymore. I don't want the benefit. And that's where we come into play, where we're trying to help people navigate all these things. And we have to learn the things ourselves. And I think that's just really important to understand, is that this is super, very, very challenging for us to understand and navigate as benefits access specialists. So imagine our customers that are coming for this help. And I would just say, I know Allison and Greg already pointed to some of the specifics of the working requirements. I think that a lot of people who have children in their household, but they used to be able to have children in the household 18 and under, like Allison had mentioned, but now once the child is 14, they're considered able to go to, that person is now classified as ABOD, or a working requirement. So this impacts, childcare, because maybe at 14, you're still not feeling comfortable leaving your child home alone for many hours. What if you have to work night shifts? So there's a lot of added layers for a family dealing with all these things. And I think this is just one more source of sort of a way to scare customers, or the customers being scared of losing benefits because they're already dealing with um, limited benefits, so a minimum SNAP benefit of $24. They're already dealing with immigration implications for those that maybe have different immigration statuses. I've already heard people saying, they don't want to apply because they fear that even though their child may be eligible, they fear that this will impact their child in the future because they potentially are undocumented or whatever the situation is. There have always been SNAP work requirements. It's not that this is a new thing. It's just the expansion of these requirements. And New York State has had a waiver since before COVID. So our waiver has now run out. So it's going to come to a shock up for as a shock to a lot of our customers. And it's going to fall on us to help them navigate this.
Yeah, no, thank you, Delia. I mean, I think
Mhm.
I remember this back in 2017, I think, in a pretty profound way as well. And it leads to, right, layers and layers of additional
Yes.
bureaucracy for the customer, for also organizations. And and there's different ways to deal with this, right? That people can, if they could theoretically go back to work, they could be in
Yeah.
workforce programs. They could also be doing some level of volunteering with groups like WSCAH. But like maybe
Yes.
Allison, you can speak a bit to like how this is sort of affecting organizations and the bureaucratic flows.
Yeah, so, as you heard from Delilah, there is a lot of confusion, both amongst the providers like WISC, like even the staff members at WISC as we try to get up to speed on the latest policy. And also just in the community, customers are, confused, they're worried. And this is all coming at a time, like I mentioned before, when the funding for SNAP administration is being cut significantly. And so the programs that fund our team members to assist clients with paperwork, they have been cut. And so, it's coming less funding, less capacity at a time when there is more bureaucracy than ever. It's not a great formula. But WSCAH itself remains committed to supporting our customers and continuing this work. And we plan to raise private dollars to ensure that our benefits team is fully staffed, that we can continue to be that reliable resource for our customers. We are also in the process of becoming an HRA community service provider. And so what that means is that we will be an approved site where SNAP recipients, ABODs, can come and volunteer at our organization, and they will be able to count those hours towards the overall work requirement so that they can maintain their benefits. And so that's really exciting, and we're looking forward to really growing that and scaling that work. But also, I guess I urge if anyone's on here from a community-based organization or other group that is able to provide volunteer opportunities, HRA is accepting more applications for groups to become community service providers. So I would just recommend that you go to the HRA website, and there's information there about how you can also become a community service provider.
Yeah, no, it's great because I mean, partly for Whiskey, it goes back to where we started. Many, we're always trying to get as many of our customers as possible uh, who are right spending their days getting food for their families. They're feeding the food insecure in their own families, right? Who also oftentimes want to be helping other people in their communities and often do. And so providing more volunteer opportunities is powerful on so many levels. And so we're excited that that's an opportunity, although it's a lot of bureaucratic hoops for the customer and for the organizations. Delilah, it's one thing for us to talk about what we're doing, how we're doing it, all these pieces, but having talked to you a bit about it, I think it's interesting for the sort of this larger audience to hear, like, with these requirements starting in the coming days on March 1st, do of the customers you speak with and alert about this, do they know what's about to hit them? Like, what are you hearing from people right now? Because I think this is the sort of part of the scariest part of this.
I'm hearing a lot of confusion, and people are coming to us, like myself and my team members, with letters or having conversations with us and saying, like, we got this letter. It says A, B, A, W. They don't even know how, like, what A bot is. They're not understanding the notices. They're not really sure what they have to do with this letter. Some people have even said, like, I just put it to the side because I didn't know what it was. I didn't know if it pertained to me. So I think there's really, just like I mentioned earlier, a lot of confusion about what is happening. I feel that people are going to be really surprised or really be taken aback, even though, HRA has said that they've sent out notices and they're trying to alert the community and things like that. I do feel that there's going to be a lot of people surprised by these things. And I'm already with anybody that I'm doing its assessments with, like new customers that want to apply for benefits. I'm already looking at the household and seeing, like, will this person potentially be under those working requirement guidelines? And if I see that they potentially will be, I'm trying to talk to them about it. I'm trying to explain the program, and, like, you might receive a letter, it's going to say this, you're going to have to do this. And as specific examples, I'm working with, I think that one of the more affected populations will be the sort of that new added age range, the 55-ish to 64 age bracket, because previously they were exempt from these requirements. I think I have two customers within that age category. One specifically I think is really interesting is she's 62. She's retired. She retired at 62. She's receiving Social Security retirement benefits. And even with that, she's fulfilled her work requirements, right? She's worked her entire life to be able to get Social Security retirement benefits. But because Social Security retirement benefits are not counted as fulfilling an exemption for working requirements, she still may be subject to complete working requirements. That's 80 hours a month of with that, whether that be working part-time, volunteering, or a combination of the of all of those things, um, unless we find some other exemption for her. So I just think that's a little bit ridiculous that somebody who's receiving Social Security retirement, 62, has fulfilled their duties of working all their life. Excuse me, and now they still have to comply just to get additional food support. So that's one situation. And then another situation that of another customer I'm working with, she is 59 or 60 years old. She's a permanent resident. So not she's been working in the US for many years, 15 to 20 years as a permanent resident, but she now has some physical disabilities because of her work, because she's worked in childcare all of these years. She has some back issues, some a hip issue, shoulder issues, but she's technically not deemed as disabled, right? And because of her status as a permanent resident, she is not yet able to qualify for SSI or Social Security temporary disability based off of these physical limitations. Um, and so now she's got physical limitations, but she's not technically classified as disabled. So she's not exempt. So now we have to use there's a medical statement form that she would have to now take to her doctor and hope that her doctor fills it out and says that she's exempt because of her physical limitations. So there's just a lot of challenges in place um, for different, for that particular age group, and also just in general, um, many additional forms to fill out, a lot more navigating. And also, once you do, like, let's say somebody starts volunteering at WSCAH or is doing some type of other work requirement program, they have to every month submit proof that they've completed these 80 hours. So it's not just a general, like, every 6 months or every time you recertify or whatever the case may be. Now it's a constant flow of paperwork every single month has to be submitted on Access HRA or to your what they're calling a PACE provider, which is like your work site. Um, and this is going to I just foresee so many issues with compliance and HRA workers potentially making wrong decisions, closing cases, and us now having to mediate more cases that maybe have been wrongfully closed. Because just remember, HRA workers, they're learning about all these programs just like we are. They're not really experts yet either. This is all new information for them. Yeah, maybe they've been trained on it a little bit longer than us, but this is all new for them as well. So there's just a big window of opportunity for a lot more errors, a lot more paperwork, a lot more case reviews, and just overall more challenging.
Yeah, I mean, more hoops
Yeah.
for people to jump through from right veterans who have served their countries,
Hmm.
who have what theoretically in their minds finished their work career and now being forced back into workforce, uh, working parents, more stresses, permanent residents, like the newly working on top of, right, as we know, right? Long-term food price inflation that just is inflation's been high, but food inflation is even higher. And people are having a tough time in New York City for a long time finding affordable housing, finding a job, let alone a sustainable job that pays like a good wage. Uh, it's a lot, right? We're also then you take that and double it from coming out of a pandemic that stressed everyone, and then this past November in the government shutdown, millions of people lost access to SNAP for a matter of weeks and were so afraid they were going to not be able to feed their families, and numbers spiked everywhere. Uh, New York, as a state, and New Yorkers in general, in the philanthropy sector, stepped up with temporary supports, but the benefits were still delayed, right? And so, like, what do you think is that sort of? I don't know if it's like the emotional or psychosocial impact for our customers related to all of this? Like, what do you sense that when you're talking to people?
Yes, I definitely do sense that. I get a lot more questions from people wondering if their SNAP benefits are even going to be there next year or whenever they have to recertify again. And I think I heard recently someone say that the November shutdown was just a preview of what we have to look forward to or how we have to navigate SNAP in the future, and I think that's really accurate. So because of that, people just have more anxiety about even just using their benefits quicker. There's a lot of community members talking to each other and just saying like you have like use all your benefits as soon as you get them. Because they might not be there, next month, or we never know when they're going to go away. So it's even before people used to, stack their benefits, maybe roll it over from month to month, so they could do like maybe save up more and do a huge shopping. But now it's kind of like people are like, you have to use them immediately. It's like use it or lose it is the mentality right now, in regards to SNAP. And I think just like I was mentioning earlier, along with the work requirements, like the requirements are just adding to the stress of other things already happening, like the $24 minimum SNAP benefit, which I also think is mostly affecting seniors who are potentially like living on Social Security or things like that because their Social Security income might be a little bit on the higher end of the income spectrum. For SNAP, they don't get their full benefit, they only get the minimum. Um, or like I also mentioned, like immigration requirements and just the spotlight on immigration and supposedly rooting out fraud and things like that. People are just very anxious about, and sometimes I'm trying to convince people like you are eligible, you can still apply, like you need this benefit for your household, and they just tell me like, no, I don't want to do it. I don't want to. And so I think that the November shutdown definitely just left a lasting, lingering anxiety in people and mistrust.
Yeah, and maybe Allison, take it up a level as we think about November and what it was, right? This was a political showdown, right?
Mhm.
The political side of this and how hunger is sort of being framed in this.
Yeah, I think it definitely did not represent the best of America during the month of November. There was a set of contingency funds that were set aside and allocated for SNAP benefits, but the federal government refused to release those funds and effectively chose to let 42 million Americans go hungry during the lead up to Thanksgiving. And they did that as like a bargaining tool to help bring an end to the government shutdown, to help push forward their own policy priorities. And it was all on the backs of, hungry Americans, hungry New Yorkers. And so I think it was just really like a shameful time. And what we saw at WSCAH was literally overnight from October 31st to November 1st, we saw immediately a doubling of the number of customers coming to get food at WSCAH. So the impact was immediate. And so, I think we're just bracing ourselves for what's to come with all these bureaucratic obstacles that are being put in place. Um, People are just going to end up relying on organizations like WSCAH to fulfill their food needs.
Yeah, I mean, I think this takes us to like, what's happening in our world. For sure. I mean, in the last couple of weeks, Allison and I, we were both up in Albany, and the first person I talked to when I got to Albany, I saw Michael Lasher, the Assembly member from the Upper West Side, and he had just come back from Minneapolis, right? And he was saying, "Wow, what's happening in Minneapolis is crazy, and every pantry is doing home delivered groceries, uh, because that's what you have to do." And I said, "Micah, that's why we're up here, because the policies at the city, most for this, the state, but also at the city level for fighting hunger are not built on these type of innovations of like home delivery or community hub distributions." And then I was lucky enough, I've had a couple interesting conversations of like, I was in Washington and then I spoke to uh, Governor Tim Walz of uh, Minnesota on Thursday, and he said he was on the front lines at pantries. They weren't handing out food at the pantries; they were doing distribution at other community sites. They were doing redistribution. They were doing home delivery. These are the models that are not sanctioned in our state policies. And this morning, lucky enough, we had Governor Hochul came by WSCAH, and we got to show her around, and she was packing food for home delivery and for community redistribution. The models that, in a sense, the state hasn't figured out should be implemented as part of this work. Like in order to deal with what's happening federally related to ICE and immigration issues and people's doing what WISC has always done, which is providing choice and dignity of service, we have to be innovative in our policies, which means we have to find ways beyond like the WISCas of the world who have amazing donors that we can work with to kickstart some of this work. We need these things in policy at a state level because if not, all the other pantries and emergency food providers across the city and state, they can't do these innovative models because their funds won't allow it. So, like, we're trying our best, right? As Allison and Delilah and the rest of the team for sure are doing. But like, where do you see, Alice, in this sort of question? Like, take this sort of innovation and policy to the next logical step, as you were on 8 calls with elected officials this week. You were in Albany the week before. Like, what are you pushing on? What are you feeling on this?
Yeah, I mean, I think just to underscore what you said, a lot of the state and city sources of funding are kind of rooted in an old school model, right? The traditional brick and mortar pantry, and maybe more recently the mobile market forms of food distribution. But the world keeps evolving, the needs keep evolving, and we need these funding sources to sort of evolve to meet the current time. And like you mentioned, I think WISCA, our models go well beyond those traditional forms of food distribution, which have their value. But we also are delivering food directly to people's homes. We're also distributing food at community hubs, which are neighborhood distribution points that are set up like a farm stand. And we also are working in collaboration with trusted partners. And those trusted partners are doing that final handoff of the food, and getting the food to people who need it the most. And so we are advocating, WISCA is fortunate that we have such an incredible community of supporters, and we have the resources to innovate and test out new models of food distribution. But we want to make sure the entire sector has those same sets of choices. And so when we're up in Albany and we're speaking with elected officials, we are asking them for that very thing. We're wanting them to expand the flexibility of these sources of funding, which are so vital to the emergency feeding network, but allow them to, evolve in the ways that our society needs currently. Um, and so we're advocating for that. We're also advocating that more dollars from those funding sources go directly to frontline food providers, because we are the ones in the trenches. We are the ones who, have our finger on the pulse in terms of what would be the best way to reach the people who are most in need of food. And if it's a immigrant community that is nervous about immigration enforcement, maybe we do need to do home delivery. Maybe we do need to partner with their local church or a local community-based organization that has already built those relationships, and are very high capacity, but don't want to open up a food pantry. Well, that's when collaboration and partnership really kind of double the impact. And so we are just wanting to make sure that the policies give us all the flexibilities that we need to do our work, which is feeding hungry people.
For sure. And I think, you said you keep saying we, which I think is really important. And, I haven't said it on the web on this town hall, but like, right, when oftentimes we talk about we're talking about frontline providers across the city and state, groups who are directly handing out food as pantries, as soup kitchens, as senior meal programs. And also that we is our collective, we have a group, right? We have the roundtable, Allies for Food Access. So we pulled together almost 8 years ago, 9 of the most innovative frontline providers in New York City, from New York Common Pantry, Holy Apostle Soup Kitchen, Met Council, St. John's Bread and Life, Campaign Against Hunger, POTS, uh, if I missed anyone, but uh, I didn't mean to. There's 9 of us who are feeding at over 800 distribution points across the city, and we work in collaboration. We purchase food together. We use an AI machine learning tool to look at invoices across all of our organizations every month, so we can get the best prices, so we can buy more New York State product, so we can, we're buying we're buying truckloads of New York State oats and New York State beans and New York State milk, and just what any product we can find that we can collectively purchase at a way much lower price to feed more people healthy, great food. And that collaboration is what is leading us to say we need more dollars to frontline providers, because when we have those dollars, right, what we know is we can make our own purchase decisions uh, that allows us to do what's right for our customers, right? Our customers who want different culturally relevant foods, and depending on the communities across New York State and New York City. Uh, but we're just really trying to find ways to collaborate on the front lines to make this work happens. And we sort of charge, like Allison, this wasn't one of the questions we've talked about, but like Allison has been leading the programs of WSCAH for 8 years, all of our programmatic efforts from food distribution across and benefits. And Delilah's almost 15 years signing people up for benefits. Like, folks know this work. And Allison, we sort of, the last few months, has like demanded that she take on, like, let's think about this bigger level of advocacy and how we use this roundtable in new ways. And so how does it, Allison, and then Delilah, sort of the same question, because you were in Albany as well last year, speaking at the press conference. Allison, like, how does it make you feel as a frontline leader to like be doing this different side of it, this sort of like, walking around the Capitol, getting on Zooms with 8 different elected officials? Like, it's a very different size and scope of the work. And how does it make you feel as a New Yorker, as a WSCAH staff person, just in general? I think it's important, like, why we do this.
Yeah. Well, it feels really exciting to be able to elevate the voices of, our customers, of the community of emergency food providers, and be able to influence, hopefully, what the budgets and the policies at the state level. I mean, I also feel really encouraged because, we're fortunate that we live in New York, New York City, and a lot of our elected officials are all like mission aligned with WSCAH, and with the sort of like the needs of their constituents, the communities that we serve. And so, in a time where the federal government, in many cases are not aligned with the, the best interests um, that we're trying to achieve. And so, yeah, I just feel really hopeful. We do have an incredible community of elected officials that are really doing, trying to do their best to represent their communities and are going to hopefully champion our policy priorities.
And Delilah, as like yourself, yeah, how's it feel for you as well? Like you, like me, like Allison, we all got young daughters, and like how's it
Yeah.
also feel as like as a mom, like in this sort of situation? As
No, it felt really like I guess I'll take it one step back first and just to say as somebody who works every day helping on the front line as we keep mentioning just helping people enroll in benefits, and it's not just only helping somebody enroll in benefits. I hear stories every single day of what that particular family is experiencing, the struggles of the family, even like highlights of the family. And I just try to take, first of all, I feel really honored in a way that the person is willing to share those things with me and feels comfortable doing so. And in a way, I feel like it's my duty to take those stories and take them to places like City Hall or the Capitol building or the halls of Congress in Washington, D.C., and be able to share those stories and experiences that have been gifted and told to me, so that I can, sometimes it feels every day, it can feel really demoralizing when I have to tell somebody, like, there's nothing else I can do, or they're crying in front of me or sharing how they have to choose which meals to buy, or like people have told me like I don't eat, or I take a really small portion of food so I can have my kids eat more food. And like you say, being a parent, it's like you never want to have to do that. Looking at my daughter every day. And so I just like hold that really dear to me that I was able to have that experience of going to these different places and advocating for the people that I see and serve every day, in a higher way, and just it makes me feel like it's just something more that I'm doing to help support that person. When sometimes day after day, the news that I have to tell people or the answer that I have to tell people is, no, I'm sorry, you're not eligible, or no, I'm sorry, this is happening, or they're coming to me with their experiences. So, and I think, as Allison was saying, like people now look to WSCA and us as a community and the benefits team as experts in what we do. And I see that when we're going to partner sites. I was recently at Assembly Member Manny de los Santos' office where I do benefits work. We have a partnership, and they were asking me, like, what have you heard about the work requirements? What should we be telling our customers and our constituents that come to this office? So they're looking to us as the experts, and to give them guidance and share what we know. So I think it all kind of just ties together, and me being able to hear those stories and share them to a higher level and advocate as much as I can. Yeah.
yeah, can you just we'll take a couple questions. I know, and Allison, I think you might take the one on state food navigators in that program. But first, we all at WSCA, I think, in some sense, are fortunate or lucky to get to like do this work each and every day. Like, what, Delilah and Allison, can folks on this town hall who are listening in, what can they do? Like, because everyone has a strength to share in some ways.
Well, I guess I can go first. I would just say I think somebody already put a comment in the chat, if I am saw correctly, about reaching out to your representatives, asking them to continue to fund HipNap and Nourish at the full $75 million. Also, something that I hold very close and dear to my heart as somebody who's once again helping people enroll in SNAP benefits is asking to raise the minimum SNAP payment from $24 a month to at least 100. And I always say this is like New Jersey's minimum benefit is $90. If New Jersey can have $90, why can't we in New York have $100 or at least match that? I don't see why not. So I think that we owe it to the people of New York City and New York State to be able to do that. So advocating for that. There will be, I believe, a slide at the end of this presentation with ways that you can find your local representative. And somebody, as I mentioned, I'm at Manny de los Santos' office. I'm also at Council Member Sean Abreu's office, Council Member Gail Brewer's office. We're in Michael Lasher's office, and we see people all the time, constituents just walking right in and airing their grievances about whatever's happening in their community. So it's really easy to just walk into your local council member's office and just say, hey, I'm here to advocate for $100 SNAP minimum or to continue funding for HIP, NAP, and Nourish. And I think that something that I recently did with a group of high school students is I challenged them to, when they go grocery shopping with their parents, take $24 in cash, have it with you, and you try to shop with $24 at the grocery store and see what you can get with $24 at the grocery store and how long do you think that would last you and your family? And just step into that person's shoes who is a SNAP recipient and that's all they have to work with for who knows how long, maybe a week or the whole month, and just kind of take that challenge on of putting yourself into that person's position of how do you use that? How do you navigate that when you're in the grocery store? I know that growing up personally, my household benefited from SNAP benefits. My mom was a SNAP recipient, and I would go to the grocery store with her, and I would see how she would have to budget and see how much money she had left on her for that month and what do we need and how to navigate that through the grocery stores. And sometimes we would get to the checkout and she would have to put things away. And how does that feel to somebody? Like how demoralizing that is when you can't give your child something that they're asking for, or just in general yourself, or if it's a senior. I've had many seniors who rely on certain foods because they're battling cancer or they have other health conditions and they need to eat a really healthy diet to support their treatment. So, yeah, my ask is just to put yourself in that person's
Empathize.
position.
So
Yep.
to learn and empathize, and then from that, tell others. And Allison, what else is coming up that people can jump in
Yeah,
with us?
yeah, sure. So the roundtable is collaborating with the consortium, so that's Food Bank, United Way, City Harvest, on a month of advocacy. And so we actually have a toolkit which we can share after this call. But there are different tools that you all can use to help in your advocacy efforts. So there is a petition. Basically, it's a tool to gather signatures to encourage the elected officials to increase and baseline the $75 million for each program, HIP, NAP, and Nourish. There's also a social media toolkit that's part of this that has different posts that you can use as a template to share with your networks on social media. And there's also some training tools on if you were to meet with your elected official, like how should that meeting be structured? Yeah, we just encourage, everybody in their own ways to reach out to their networks, potentially collect signatures, just do what you can to let our electeds know that there are a whole lot of us who want to make sure that these programs are fully funded so that no New Yorker goes hungry.
Yeah, for sure. And of course, you can volunteer, right? You can volunteer with WSCAH at any of our locations. You can go through our New York Care site, you can go on our website, or any other the members of the roundtable, or any emergency food provider wherever you live and whatever. Like there are people fighting hunger in every neighborhood in the city and state, and so everyone has a space that they could hopefully find a little time for themselves or with, with their children, with their cousins, neighbors, make it a group activity. We're doing more and more of that because I think people really want to give back and do something, whether it's advocating, whether it's volunteering. Obviously, donations, we are all appreciative in the anti-hunger world of direct dollar donations because they're often less restrictive than some of the state and city funds. Like we need the dollars to make sure our staff are paid, that we can pay benefits, that we can do the work we know is best, and then we make sure we have the best people doing this work. And so it's really important to have financial support. It's just this is how work happens. We have a little bit of time. I know there was one comment, and I don't know, Allison, if you want to speak to the state food navigation plan,
Yeah,
which is
so
a new transition of this model.
exactly. So this is a new RFP that was put out by the state. But what it essentially does, so the purpose of the grant is to fund in part SNAP outreach and education. So um, it basically will fund staff members who help and support the SNAP application and recertification process. However, whereas our previous grants, we would get 100% funding through those sources. Now the state is shifting the cost onto local nonprofits. So the state is committing to the 25% that's going to be covered by the federal government, and then the 75% of the other funding that needs to be matched is basically being put on the backs of the frontline food providers. So the Nutrition Navigator grant, it's a similar scope of work, except for the funding is for at least for WSCAH is going from 100% funding to 25% funding. So while the scope is the same, the level of support is
And this
less.
goes back to what we started the conversation in, right? Like federal funding on SNAP is getting cut, shifting dollars and demand of spending to states. States are shifting those expenses down to cities and frontline providers. So we're going to be asked to raise money to cover dollars for a state program with all of the state bureaucracy for what? Like it becomes a question. Like is as they say, is the juice worth the squeeze? We're going to keep doing benefits enrollment and making sure our customers have access to amazing team members and leaders like Delilah. But like it might be that we decide that those funding pots aren't the best way to do that. That it can be less restrictive and we can do things in different ways if we don't feel this, if it's these sort of restrictions. I mean, I think this is where innovation comes in, right? Like we have to be able to do things the way is important to actually meet the needs of the 21st century, not from the 1970s and 80s. The world has changed. And I think that maybe as we can end on these two sort of, maybe it's a bit of positivity on this of like, what are two, like Allison, just in 30 seconds, hit on Grail, and then Delilah hit on the power of what we're doing with our new Salesforce and home delivery. Because I think this shows like there are models that the state and city aren't used to funding that we're taking to the next level.
Yeah, sure. So, as Greg alluded to before, the Roundtable has developed a new AI machine learning tool that allows thousands of lines of data to be scanned in and populate, a database in a fraction of the time it would take otherwise, just doing it manually. And so, what this means is that we will have more data in real time from more sources. So, with the ultimate goal of being able to strategically make purchases at lowest cost, highest quality. It just gives us more knowledge to be able to make the right choices. And the goal over time, right now, the round table, the 9 members are accessing this information, but the goal over time is to build the capacity of this tool and to be able to share it with the broader emergency feeding network so that we can all be getting more food for lower cost.
Yeah, and then which when we get more food for lower cost, it's getting it to more customers in need. And so the new Salesforce, Delilah, and our home, like what,
Mhm.
how is this helping us access and help our customers?
I think it's just a better way to track data for us and like entering when we're speaking with customers, being able to provide better follow-up, being able to run better reports and just track different things that funders are asking of us. And also it's a way we're using it as a way to reach out to customers. Like we can run up a report very quickly and just say, oh, these people, we enrolled this group of people in SNAP 1 year ago. Those people are all due for a recertification. Let's reach out to them to see if they need help with that. So that's like a certain way we can use the benefit and just texting. There's a text feature in Salesforce where you can do massive text directly from Salesforce, so that people know that they're scheduled for an appointment. So there's a lot of ways that this new Salesforce and a lot of a lot of information that we were having to do external spreadsheets and Excel sheets, everything is now in one database, and easier for everybody to use the data.
I mean, I think this is all key. It's like, and
Yeah.
sometimes it's like coming full circle, right? Like we're seeing more restrictions on SNAP, more bureaucracy, and we at the same time are trying to make things lighter and easier and less friction. We want less friction for organizations to be able to get the food, and we want less friction for customers to have access to that food. So we're going to do everything we can to keep raising money and feeding more people across the city. And we thank everyone for their time. We want to be mindful of this time that we've hit 2 o'clock. We'll send out follow-ups to everyone who registered. But thank you so much for joining us. Thank you, Allison. Thank you, Delilah. Thank you for the whole WSCAH team.
Yeah.
Uh, have a great day, folks.
Thank you.
Thank you.